my name is Stephanie Lyle, and today I am performing for you the intradermal injection video. For this video, we want to make sure I have all my supplies. I don't have a biohazard or a red sharps container, but this will act as my sharps container. I have my gloves, I have my medication, I have my syringe and needle, I have some gauze and my alcohol wipes, and I have my patient. So first thing I'm going to want to do is make sure, like I said, all my supplies are gathered. I'm going to verify the order in the MAR over at the Pyxis. So the order is for tuberculin 5 TUs per 0.1 mLs. The medication label reads that for every 5 TUs, it's 0.1 mLs. So for this demonstration, I will only have to draw up 0.1 mLs. There's no math conversion needed. So after I verified the medication, I'm going to go through the 6 rights to make sure I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. So after I've verified all that, I'll bring my supplies into the patient room. I'm going to close the door behind me, ensuring patient privacy. If the patient has family or friends there, I'm going to ask if the patient is comfortable in having the family members or friends stay in the room while we go through some PHI. This patient is alone in the room, so next I'll go on by verifying patient name and date of birth. Can you please verify, before that though, I have to introduce myself. So my name is Stephanie, I'm going to be your nurse today. Can you please verify your name and date of birth? Perfect, I have verified that on their wristband. So next we're gonna go ahead and move on. Again, I'm going to verify medication, dosing, and that at patient bedside. And I'm going to ask patient, do you have any allergies? And the patient states they do not have any allergies. So next I'm going to go over the medication with the patient. Patient, today the doctor has ordered you to have a inter-dermal injection of tuberculin. This is to verify if you've had any, if you've been exposed to tuberculosis in your past. So to do this, it's going to be a small injection of the medication, intradermal, so just right underneath the first layer of skin, and it will create a small wheal looking like a little mosquito bite on your forearm. Some side effects that can happen are some burning during the injection of the medication. Some side effects could be some redness and swelling at the injection site. If you notice that and it lasts anywhere from like 2 days to 2 weeks, you definitely want to let us know if it continues so that we can address it right away. Something else to think about is you will need to make sure that if you're discharged before 48 hours, you're going to want to make sure you follow up with your primary care, because the results of this test will need to be read within 48 to 72 hours. So just something else to keep in mind. After the patient has agreed to has given consent to this test, next I'm going to verify again that the medication is for tuberculin 5 TUs per 1 ml. So I'll just have to get 0.1 mLs drawn up for the medication. I think I misspoke a few moments ago. So this is tuberculin 5 TUs per 0.1 mLs. So I'll be giving the patient 0.1 mLs. So I will go ahead and make sure, get that started. So first thing I'm going to do is perform hand hygiene, and then I'm going to apply clean gloves. This medication has not been opened yet, so I will go ahead and remove the cap. Put that in the trash. Next, I'm going to clean the top with alcohol wipe. Even though it's a new bottle, we still want to make sure that it's clean for the patient. Put that in the trash as well. Next, we're going to draw up the medication. So this, I have it's given to us already. So it's 1 ml syringe with a 25 gauge needle, and the length of the needle is 5/8. So I'll go ahead and open this up. Put that in the trash. Next, I'm going to draw this out to 0.1 mLs. 0.1 mLs. And then I'm going to inject this into the vial. I'm going to push the air in. I'm going to invert it and then draw back slowly to 0.1 mLs, making sure there's no air bubbles. If there were, I would gently tap the syringe just to make sure there are no air bubbles. But this looks like it's going to be okay. Next, I'm going to scoop this back on so that it's ready to go. And that's my 0.1 mLs. Hopefully you can see that medication. All right. So next I'm going to throw this away into the trash. And now I'm going to inspect the patient arm. So to place this medication, you want to use your antecubital site and your wrist as landmarks. So you want to go like 4 fingers from the antecubital site, but also maybe a hand width away from your wrist. So somewhere right in here is where we're going to be injecting, and that will be right here for the patient. So next we're going to perform hand hygiene again. Now that I've found my location for the medication, apply clean gloves. I'm going to clean the area with an alcohol wipe. Trash. Starting at the center, I'm going to work my way out to about 2 centimeters width, just making sure that it's nice and clean. I'm not going to repalpate the site. I'm going to let this fully air dry so that the alcohol wipe can do a good job of clearing away the bacteria. Next, I'm going to inject the patient with the medication with my dominant hand. Uncap it. So I have the bevel up. Hopefully you can kind of see. All right, and now I'm going to gently pull the skin taut. I am going to inject at a 5 to 15 degree angle, just under like this, till about 3 mLs of the needle are in, and then I'm going to gently push the medication in. It should make a wheel, but because of the material, it doesn't look like it's going to. So then at that point, I would remove the needle, dispose of it in the sharps container, gently lay on top a gauze, clean gauze, in case any of the medication leaked out, or if there's any slight bleeding from the initial penetration of the needle. Making sure that it's okay. I don't want to press on it because I don't want any of the medication to come out. Go ahead and throw that away. At this point, I would ask the patient, are you feeling okay? Is there anything I can get for you? patient states no, they're feeling okay, they've got no issues. So next I would go ahead and remove my gloves again, perform hand hygiene. I would exit the patient room, closing the door behind me, and then I would go and document the procedure. I would document if the patient had any side effects or any adverse reactions. I think that's it. All right, thank you.